We interrupt this programming for a special news bulletin. President Obama is about to speak to the people of the United States momentarily about the health care reform bill.
Last night, President Obama promised that he would address the nation about the status of this bill.
We have just received word that President Obama is about to speak now. We're going live.
Good evening. As promised in my State of the Union address last night, I am going to be speaking to you all about the status of the health care reform bill. The point of my speech is to persuade the American people that we need to get this passed. I will be starting my speech tonight by talking about the history behind the health care reform bill. The idea of universal health care in the United States started circulating before my administration many years ago, with presidents such as FDR, Truman, Clinton, and many others have been pushing for this idea of health care reform. Each one of them has had a different idea of it. In 1935, President Roosevelt introduced his idea of health care reform. This idea would have included some kind of national health insurance program in Social Security. This failed. In 1945, President Truman proposed a nationwide health care program with an insurance fund that everyone would pay into. His plan, like Roosevelt, also failed. Prior to my administration, an attempt was made by former President Bill Clinton. He offered a proposal that, like others, suffered failure. His idea was worked on behind closed doors for 10 months, after which it was picked apart by lobbyists who disagreed with it. While many of you will agree with me that this is something good to have, I ask myself why nothing has been done to ensure that the American people have the health care protection that they desperately need. One of those reasons why most uninsured Americans lack health coverage is because of affordability. There are people in the United States that have to choose between having food and shelter versus health coverage. Now for some statistics. In the year 2003, there were 42.5 million Americans who were uninsured. A couple of years later, in 2005, the CDC reported that 40+ million Americans of all ages, including children, went without health care coverage during some point of that year. In 2011, the CDC reported that 50 million Americans lacked health coverage, which is very alarming. Without health coverage, life expectancies are cut short. It is important that insurance carriers and our elected officials that hold office understand that during times of hardships, people tend to make sacrifices to survive. This shows that it is time for us to make the next step. When I think of healthcare reform and how desperately our nation needs it, I think of the story of Patricia Nelson and her husband William. William developed Lou Gehrig's disease at the age of 35. Since they had insurance through Medicare, it was ensured that during the final stages of his life, his wife Patricia would be able to take care of him in their home, with doctors and therapists and nurses stopping by periodically at a small cost to them. Patricia understood that the value of health care was important, but her and her son had went without since 2000. She goes by saying that having health insurance depends on the employer. Eventually, both her and her son got sick and the hospital bills stacked up. She was denied health coverage because her family missed the cutoff by $4. Unfortunately, she had to receive care for this and ended up with a $12,000 hospital bill and had to file bankruptcy. The current health care legislation that was planned by my administration will produce savings of $138 billion over the course of the next 10 years. Over the course of the next 9 to 10 years, new regulations will be put into place. Some of the most crucial dates in this article are the years of 2012, 2014, 2016, 2018, and 2020. In 2012, the Medicare payroll tax will be expanded to include unearned income. In the year 2014, insurance companies will not be able to deny coverage due to pre-existing conditions. In the year 2016, The federal government will pay 100% of costs for covering newly eligible individuals through Medicaid. In 2018, insurance companies will pay a 40% excise tax on high-end insurance plans worth over $27,500 for families or $10,200 for individuals. Finally, in the year 2020, the Medicare prescription drug donut hole is expected to be closed. Two main purposes of this bill are to close loopholes in the United States healthcare system and guarantee healthcare coverage to everyone with the exception of illegal immigrants. In closing, I urge all of you to write your congressmen or congresswomen and tell them that our nation needs to push for healthcare reform. This has been an ongoing issue for decades and nothing has been done yet. There have been plenty of great ideas that have been proposed, but we are not moving forward with them quickly enough. It is imperative that we move forward as a nation to solve this issue head on. Thank you, and God bless the United States of America.
President Obama's speech was very powerful and made us think here in the newsroom. The question that we would like to leave with our viewers is, what can we do to change history and put his health care reform bill into action? We also urge you to write your congressmen and congresswomen to address this issue. Please take heed to the address that the president just made. Thank you and good night.